Good afternoon, everybody. This is Erin with the Department of Medicaid. It's not quite 1 o'clock and we're still getting the waiting room clear, so we'll give it just a few minutes before we get started.
Hi, everyone.
Good afternoon, Lisa. I think I just realized a minute ago I said it's not quite 1 o'clock. I meant 3 o'clock. Let's not go back to 1 today. Let's keep moving forward. Sorry about that. The
Right?
waiting room's almost clears. If we want to give it just another minute or so till we're clear, I'll let you know.
Okay. Okay, great. I hope everybody's well. I understand it's beautiful outside. I notice all of us are inside, but rumor has it it's very pretty outside. It's in the 60s, the sun's shining, flowers are wanting to bloom.
Okay, it looks like the waiting room is clear if you would like to start. Lisa, I have you, Dee, and Eva on. If I missed Jennifer or April while they were logging in, I do apologize. But you have 3 out of the 5, so you do have a quorum.
We have a quorum. That's beautiful. Okay. Hello, everybody. It's good to see everyone. I hope you had a great Christmas, New Year's, Valentine's Day. It seems like such a long time ago since we saw each other. December 14th minutes. Did anybody have a chance, or did all of you have a chance, rather, I should say, to take a look at those?
I'm looking for them now, Lisa, and just to make sure that I did review them before I make a motion, since we do have a quorum, to approve those minutes. I just want to eyeball them one more time.
Absolutely. Absolutely. No rush.
I can't see them. And did we have a quorum then even to have a meeting?
You can have a meeting without a quorum, you just can't vote. It looks like the minute meeting, went out on 1/8.
Okay, thank you.
You're welcome.
It might be quicker if somebody just sent them to me again.
Give me 1 second, Dee, and I'll send it right there to you.
Thank you.
My notes do show that there was not a quorum last meeting, so you did not approve the October minutes.
Oh. Okay,
So if we want to approve both of those while you have a quorum today.
well, we probably should. Now I'll need to go back and,
If you would like, in interest of time, we can move forward and I'll go ahead and forward you the October minutes for a quick review as well. And then we can approve those later. Does that work
it
for the
sounds
TAC?
great.
Perfect.
Yeah, that's fine.
Cause I didn't go back and look at that. And hopefully we all remember. Of course, the minutes will help us remember. So. Okay. Since that's going on, and thank you very much for keeping us on track and for going back and resending those items to us. We're all appreciative of that. If everybody's all right, we'll go ahead and move into our old business. Heads nodding. Okay, great. So old business update from CMS on the updated school-based Medicaid technical assistance guide and plans to get updated document to the schools. Where are we with that? Does anybody know the answer to that?
Hi, this is Erica with Kentucky Medicaid. We have already sent out the technical assistance guide. And so that should be available to all of the school districts now.
Wonderful. Thank you.
You're welcome.
Any questions for Erica, guys, on that? Was that it? Okay. All right. Just making sure before we move on. School-based Medicaid. Eva? Did I lose? Oh, no, there she is.
I think she froze on us for a moment.
Can you hear me?
Oh, yeah, barely. It's like you're in a tunnel.
I don't know what's going on. Do I need to yell?
No, wait, actually, you sound a little bit better.
I'm not sure what that was. School-based Medicaid is a bullet by itself. I don't remember. Other than just the questions about the technical assistance guide and the data requests that we had.
Okay. Okay. So for that, we can go ahead and move on to the data request then. And I know that you were a big part of that. 2022 data on expanded Medicaid billing in schools to include by all school districts the number of types of services that were provided by quarter for expanded Medicaid billing in Kentucky.
I can tell you the data is still being reviewed by upper management, but I believe Erica Jones has someone on to kind of give you a brief overview.
Okay.
Hi, Annette Newsom is our school-based services coordinator, and she did pull some data together, and she has a presentation. She can show how things were last year.
Wonderful. Thank you.
All right. Can you hear me? Okay, perfect. All right. We have 171 school districts. However, 168 are school-based services, but there's only 58 that has expanded access and free care. On the billed quantity for the first quarter was 8,550. For the second quarter, it was 13,563. The third quarter was 18,340. I'm sorry, I couldn't get mine to come up.
I got you.
And-
Teamwork.
Thank you.
Yeah, now we see it. I did this
Yes.
yesterday. I couldn't find anything.
I couldn't get it to come up. I apologize.
I understand.
For the third quarter, there was 18,340. And then for the fourth quarter, 7,569. With that being said, only 49 districts actually billed for the fiscal year 2023. So I did go in to verify, what services that was being done and rank them. So in our first place is nursing services. Second place is behavioral health, which is substantially lower than the nursing services. Therapy was third. However, in the first and second quarter, it was medical was fourth and speech was fifth. However, that fluctuated in the third and fourth quarter. For lab work and test, it was sixth place. The only reason was because we actually had only 4 for the entire year. And then for vaccines, there was absolutely none. So that kind of gives you a little rundown of what you're looking at. And if you ever need anything, please feel free to reach out to me or Erica, either one.
I'm thanking you and I'm on mute. I'm sorry. Thank you very much for your
You're fine.
presentation.
Thank you.
Mhm.
And
Dr. Stone, do you have any questions?
so I just wanted to ask about what kind of revenue, is there any averages that generated for the districts?
No, I didn't do that, but if I can definitely get it back to you.
I'm just curious by the services that were ranked, if it creates any model for sustainability of health services of all kinds, not just nursing, but other kinds as well.
Mhm.
Thank you.
Oh, you're welcome.
Okay, thank you.
Do you want to skip back or go back to the October and December minutes, Lisa?
Okay,
I would like to make a motion to approve the minutes from the October nursing TAC and the December nursing TAC meetings.
wonderful.
And I'll
Eva?
second. I'll second with an eye.
Okay, so motion is approved. I'll make the third. That's good. Little housekeeping there. Great. Erin, thank you for doing that for us.
You're very welcome.
No, tuck them away. Okay, great. So we'll move on to the next point of our old business, our last one, MCO data request, 5 lowest counties utilizing value-added benefits.
Hi.
I should have, oh, I'm sorry.
Oh, sorry, sorry. I'm sorry, go ahead.
No, I was just gonna let the tech know that all of those all that data from the MCO should have hit your all's inbox earlier this week. Sorry, I'm having a problem talking today, so I'm stuttering over my words. So you should have received that data. If you didn't, let me know and I'm happy to resend it back to you guys. And Paige, I'm sorry, I didn't mean to cut you off. If you want to go ahead.
Oh, no, that's fine. I was just gonna say, this is Anna with Passport. I had that data, but if it's already been sent, then I can share or not share.
Oh,
Up to you
yes,
all.
go ahead and share. That'd be fine. I'm looking, because I'm sitting here looking for it.
Yeah,
If you've got it right on hand, that would be great.
yeah. So I just put,
okay.
I put together
go ahead.
just a few data points, not a lot of interesting information or really nothing to share in forms of a PowerPoint or presentation. But our 5 lowest counties for members that utilize incentives, or we call them value-added benefits, were Boone County, Breathitt, Pendleton, Pulaski, and Trigg. They had not an impressive number, a total of 5 rewards requested and received. But the value-based benefits members have up to 90 days to request. So actually they have until March of 2024 to request those. So it was very low utilization of the value-added benefits in those 5 counties, but also those 5 counties make up less than 1% of our overall membership for Medicaid. So that was our data on the lowest utilizers by county.
Okay. Any questions, guys? No?
And I forwarded that to you guys again, so it's right there in
Did
front of you
you?
if you
Okay.
wanted to
All right.
look at it
Thank
real
you.
quick and see if you had questions. You're welcome.
Okay.
I don't
All
know if your
right.
email looks anything like mine. Things get lost and buried very quickly.
Well, yes, I do have a nice file that I put all my TAC things into, but even that gets quite crowded after a while. So we get a lot of very good information from you all and a lot of good data shares. And I also share all of that with the Kentucky Nurses Association. So things that are pertinent and or appropriate to share with the entire, well, everything is shared with the entire board of directors, but from there they also share it with the chapters if it's applicable. So your information gets utilized and is appreciated. So thank you all for all of that, and you're very good communicators, and it's again that's very appreciated. So moving on, if there anything else on old business that whether it's listed or not, is there anything?
Yeah, this is Carrie Wilson with Humana Healthy Horizons. I do have something to present. We sent the PowerPoint over, I think it was yesterday, just of our value added benefits. Do you mind if I share my screen?
No, absolutely not. Go right ahead. Thank you.
Give me just a minute, Carrie, to make you a co-host.
Okay. Just let me know when you can see it. Can you see it now? Okay, good. All right. Does that not make you hungry? Look at the nice fresh fruit.
Especially
so
this
our
time of day.
Our bottom 5 counties by utilization, we just did a little PowerPoint of what's our bottom 5 counties. Of course, this is just of all counties. So we broke it down also on the next slide of the bottom 5 counties utilization by 1,000, greater or equal to 1,000, sorry. So these are, so Grace and Oldham, I won't read through it, but these are our bottom 5 by membership greater than 1,000. And that's all I have. It's not much, but short and sweet. But if you want to look at this a little bit more, just let me know.
Yeah, I'm going to tell you, I'm surprised Oldham County was on there. That surprised me.
Yeah, yeah. All right. Do you have any questions?
Oh, I just want to ask to anybody who may know, are the value added benefits anything that Family Resource Center coordinators are educated on at their conferences or anyway on a state level?
This is Stuart on with WellCare. And I know we absolutely do. We share that with the Friskies or whatever, educate them on that. We absolutely do that.
Eva, I can also say we do have some Frisky members that are on other TACs as well. And
Thank
value
you.
added benefits is something that all the TACs discuss.
Are
Okay.
having conversations about.
Thank you.
Okay. Anything else? Good question. Okay. With that said, we'll move on to new business discussion on November 2022 MAC about the DMS response.
So I'm bringing this back to the nursing TAC to make a recommendation to the MAC that DMS reconsider its position on the recognition of LCPMs as providers for reimbursement by Kentucky Medicaid. We did have a DMS response to the MAC's recommendation back in 2022, and it essentially DMS stated that there would be an additional strain on EMS services, ambulance transportation services, if Medicaid were to recognize LCPMs as providers for Medicaid reimbursement. Many supporters of LCPM care in Kentucky, as well as home birth in Kentucky, find that that's not a realistic statement. We don't find that, given the small number of home births that are occurring in Kentucky, that by having Medicaid recognize those providers for reimbursement, that would strain the system for transport, because I mean, there are several reasons that I've brought to the nursing TAC, which we could discuss in greater detail, but it boils down to most transfers from a home to a hospital in case of an emergency are for non-emergent reasons, such as failure to progress, need for pain medication, and they're not transported by ambulance. So if the small number of home births that are occurring currently, and you look at the statistics of in other states, what home birth transports happen in emergent situations, the number's pretty small, and we don't see a correlation between recognition of LCPMs as providers for Medicaid reimbursement and an increase in ambulance utilization. So for that reason, I think we should make another recommendation to the MAC to have that LCPM provider be recognized by Medicaid for reimbursement purposes.
I don't disagree. I will say that I know that even looking at the news, it's access to care and some of the struggles with midwives and different programs has been in the news again, along with the struggles in rural communities to find maternal child care. It's really difficult. We have people, amazing that in 2024 people would struggle that much to find safe maternal child care. Is shocking. It really is shocking. I'm in favor of that. Eva, how do you feel about that?
I would absolutely agree. You know, there's just not data to support the rationale for not including them as that provider.
Right. Right.
So
Well,
I'd like to make a motion that the nursing TAC make another recommendation to the MAC, and that would be to urge DMS to recognize that LCPMs are eligible providers for Medicaid reimbursement for their services. They're licensed, they're regulated by the state, they're licensed by the Kentucky Board of Nursing. And we did have that support from the MAC in 2022. So I'll make that recommendation that the MAC brings that back to DMS.
I'm in favor. Yep. Oh, there we go. Sorry. You got a first and a second all at the same time. So let's plan ahead, because when the next MAC comes around, I'll need you to be there. Okay?
I believe it's in March, correct?
Yes. Yes. Aaron, am I right? That is correct, isn't it?
Yes, ma'am, the 28th.
We just met, okay,
And make sure to just, when the TAC votes on that, to make sure to follow that up in writing, so that way I have exactly word for word what it is that the TAC is requesting. I do my best to capture it, but I don't always catch it all.
I'll go ahead and make a recommendation in writing. I'll forward it to Lisa, to Eva, and to the other members of the nursing TAC, and we'll loop you in as well, Erin, so that I don't know that you need an official signature, just something in writing. Is that correct?
Yes, ma'am. I just like to have it in writing. I try with 17 of you guys. I try to be subject experts with all of you, but I'm not. So I just don't want to get any wording incorrectly. So I like to always follow that up in writing to make sure I don't miss anything.
perfect. Thank you. And Dee, thank you. Thank you.
You're
for
welcome,
putting this
Lisa. And what
forward.
I'll likely do is just condense the sort of write-up that I sent to the nursing TAC earlier this month, and sort of condense it to give something a little less verbose to the MAC to review. Okay.
Hi, this is Dr. Terrio. There is a bill going through right now that will legislate that Medicaid cover midwives. And so I just want to say that we're watching that closely, because your recommendation may not need to go anywhere.
That would be ideal, yes.
And I know you'll be there at MAC to cheer us on, right?
Oh yeah, it's always fun.
Because you have definitely been a cheerleader all along and so appreciated. So thank you. Yeah, best case scenario, this resolves itself very soon. So. Okay. Is that our shortest meeting in history? No. Is there anything else we need to talk about, guys?
I do have one thing, really just to ask. It'd probably be a question for the next meeting, but just in getting feedback from some of the nurses or people clinicians doing school health around the state, there was a clinic, a school-based clinic, so not billing through expanded Medicaid, but billing through traditional with the MCOs, that says that any claims they submit to a particular MCO are denied because they don't recognize the school as a place of service. And I just want to ask, and again, next meeting can be a question, I mean, can be on that agenda, but I just want to ask the question, our schools, our clinics, is there a reason that school-based clinics would be limited by a managed care organization as a place of service for reimbursement? And if so, why would that be? Because there's lots of school-based clinics around the state that are reimbursed. And so I'm just curious if that is just a standard or if there could be a particular issue with just a clinic.
Dr. Stewart of I Want to Well Care, and I'm, big qualifier. Don't quote me on this, but one thing maybe, I know there are school-based services that are carved out from DMS fee-for-service. That may be what's going on here. Certain services, I know, like if the child has an IED, like essentially disability or something like that, there are certain services that are carved out from managed care. Perhaps that's it. I don't know. I know you're talking about next meeting, but just thought I'd throw that out there.
Yeah,
could be
well,
that
I
thing.
appreciate that. That is, I mean, I know that is one service. This is a clinic, though. This is a clinic that's just housed in a school. So it's an advanced practice nurse that's having claims denied for services. So anyway, it was just a question because I didn't know if there was something that would allow an MCO to deny claims for clinic services.
Justin Derringer has his hand raised.
Thank you. Hi, this is Justin Derringer. I wanted to say that there's no specific policy in place that prohibits that. So we would have to see the exact situation, and we'd have to look into it. It's probably something specific to the clinic or the way they're billing or
Okay.
something in their MCO contract or something like that. But as far as is that a broad-based policy, the answer is no.
Okay, thank you. I don't have anything else, Lisa. You're on mute.
Because I was talking with my mute on. Okay, to our MCO partners, do you have anything for us? Anything you want to bring forward?
From Passport, this is Anna. Nothing new to
Okay,
bring forward.
Stuart,
Stephanie?
well, Karen, nothing, just, I mean, one thing, we're all really promoting the immunizations. There's some core measures like that we're all really trying to promote and encourage right now, a couple of immunizations. So I know you all are involved with that, but that's ongoing. That'll be ongoing, but nothing else really.
okay, great. I'm glad you're doing that. That's great, great. Thank you. Anyone else?
This is Stephanie with Anthem. We're good. Thank you for the opportunity.
Oh, thank you. Anybody else? Okay. Well, everyone, I think that covers us for today. So Dee's got some homework to do, and she's going to pull that together and get it sent to the members of the nursing TAC, and including Aaron, of course, on that communication, so that we have something official as we move forward to looking at bringing this forward again in March. And I believe with that, we're going to have an early closure today, unless there's an objection.
I'll make a motion to adjourn.
This is Jen Wiseman. I'll second.
Oh, Jen, we didn't know you joined us. I'm so glad that
I
you
didn't want to interrupt.
Oh,
so
that's
I've just been
okay. That's
listening
okay.
quietly.
Yeah, no,
I
I'm glad you
also
were
came
able
to the meeting late.
Yeah.
But I'm here
Oh,
too.
and April Hester, hi. Thank you both for making it. I'm glad you all were able to join. That's wonderful.
Thank you.
It was kind of quick today, but I'm grateful that you were able to join in. Do you have any questions for us? Are you okay with us adjourning?
I'm okay.
Okay, all right. All right, with that, then I'll go ahead and adjourn the meeting and wish you all well. We will reconvene on May 16th, and we will be at MAC on March, is it 24th again? Tell me again.
28th.
28th. Okay. All right, great. All right. Till
Have a good
then,
day.
have a good day,
Thank you.
everyone. Thank you.
You too.